Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Jessica Metcalf of Hamilton Spine Health and Sport in Dalton, Georgia. Jessica is a manual therapist at Hamilton Spine Health and Sport inside Bradley Wellness Center, located at 1225 Broadrick Drive, Dalton, Georgia. Hamilton Spine Health and Sport is comprised of a multidisciplinary team of manual therapists, a certified performance trainer, and a golf instructor. Today we're going to talk about sciatica. Jessica, what is sciatica?
So sciatica is typically pain, numbness, and or tingling that radiates down the back of the leg along the path of that sciatic nerve. What we consider to be true sciatica is when the patient cannot fully extend the knee while in a sitting position due to that pain. This is because true sciatica is typically a stretching issue of the nerve where the nerve is being compressed either from swelling or a disc herniation.
Well, Jessica, are a lot of cases of leg pain due to sciatica?
Not always. So there can be symptoms in the back of the leg that are not necessarily caused by sciatica. You can get some irritation around the sciatic nerve that may cause pain, numbness, and tingling in the leg. But if you can fully straighten the knee out from a sitting position, then we don't consider this to be true sciatica, but more just irritation of the nerve. There can also be pain in the back of the leg or buttock area that is not caused by the sciatic nerve at all. Sometimes this can be caused by poor posture and mechanics. If a person has improper sitting or standing posture, this can create increased stress and strain in the muscles of the back and of the leg, including the glutes and the hamstrings, which we often find is the culprit of a lot of buttock or leg pain. We can treat both sciatica as well as leg pain that may not necessarily be true sciatica. When we do our examination, we are looking for a specific type of dysfunction in the joints of the lower back, which create the pain that we are talking about. This dysfunction is a protective reflex that happens when the joints of the spine have been injured, and it doesn't allow them to move properly. When this reflex is present, the person cannot bend or move correctly in the lower back, which creates compensations in their posture and other mechanics, which increases the workload on not only the lower back, but also the glutes and the hamstrings, and can sometimes increase tension on the sciatic nerve as well.
How do you treat these issues?
We are physical therapists, but we specialize in a specific type of manual physical therapy for the spine, where we use our hands for a lot of the treatments that we provide. When we evaluate a patient, we are looking for a specific type of protective reflex called the arthrokinematic reflex, which does not allow the joint to function or move appropriately. We assess each joint in the lower back and determine if it is mechanically moving properly or if the reflex is present that is not allowing the joint to function. If we find that reflex, then our job is to eliminate it. We use our manual therapy techniques, which are very gentle, to restore function to the joint. Once the joint can move properly, we work to correct any compensations in posture and mechanics that we find. We will retrain you on how to move correctly and teach you correct sitting and standing posture. Correct mechanics is a very important piece when we are talking about long-term relief, but the joints have to be able to move appropriately in order for you to be able to have those correct mechanics in the first place, and we address both of these issues during our treatments. So if this protective reflex that we look for when we do our assessment is present, it can make you unable to bend correctly in your lower back. In order to be able to sit correctly, and in some cases comfortably, you need to be able to bend in your lower back. So if you cannot do that, then your body will compensate and you will adopt an abnormal sitting posture, which can cause more problems over time. Some typical compensations we see with sitting posture are where people will either sit with their behind scooted all the way to the back of the chair and hold themselves very erect when they're sitting, or they will use some type of lumbar support or pillow that they'll put behind the lower back to help hold themselves in this position. This abnormal sitting posture will cause increased stress and strain on the lower back, and it can even lessen the space where the nerve is because of the position of the joint when you're in this posture. Your body actually works harder when you're sitting in this position. All of this can lead to leg pain and make leg pain worse. So just like with sitting, your standing posture will become altered when this protective reflex is present. If the joints of the lower back do not move correctly, then standing with proper posture and with the glutes and the back muscles relaxed is nearly impossible. For this reason, people typically adopt more of a forward bend posture where they are leaned really far forward when walking or standing. Again, this is another position that your body has to work harder to maintain. Your lower back, your glutes, your hamstrings, even the calves and the feet have have to work very hard in this position to hold you up. So this creates a lot of fatigue and overuse of these muscles, but it also puts tension on the nerve roots, all of which can lead to leg pain. So the goal of our treatment is to get the joint to function and move properly so that you can begin to sit, walk, and stand with proper mechanics, and to allow the overworked muscles to heal and to work within their design and to release tension and strain on the nerve.
When should someone seek out pain management?
So we have an amazing pain management and neurosurgery team at Hamilton that often refer patients to us, but we also will refer patients to them when appropriate. So we typically will refer a patient to pain management for an epidural steroid or some other type of intervention that may be suggested by the doctor if the patient has unrelenting leg pain that is not lessened by our manual therapy techniques, or if the patient is in so much pain that we cannot perform our techniques effectively. In those cases, there is often so much swelling or inflammation around the nerve root that the pain is constant, and the medication can help to calm down some of that inflammation and pain in order for us to more appropriately perform our treatments. So we just talked about how the epidural can help to calm down the inflammation. This can help to significantly lessen the pain. However, the injection does not get rid of why the pain was there to begin with. It will not get rid of that protective reflex that we are treating that alter your mechanics. So the mechanical dysfunction within that joint will be there regardless of the pain. So just because you are feeling better doesn't mean that the problem is gone. So yes, you should still come to your physical therapy visit even if you are feeling better, and let us assess and treat any dysfunction in the joint that we find, and this will dramatically decrease the risk of that pain returning down the road.
Jessica, thank you so much for being on the show today. We've learned so much.
It was my pleasure, Bobby.
For more information or an appointment at Hamilton Spine Health and Sport, call 706-529-3686 or visit hamiltonhealth.com/spineandsport. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.